Welcome to G.O.S.T Stories, hosted by LocalMed, where we share stories of some of the remarkable friends in dentistry we've had the opportunity to meet, partner with, and serve.
Hello everyone, my name is Vanessa, and I am here with everyone's favorite goat, G.O.S.T, G.O.S.T the Goat. As you may recall, G.O.S.T stands for Get Online Scheduling Today, and we're here doing another chapter of G.O.S.T Stories. Today we have a very special guest all the way from South Carolina, Dr. Daphne Pierce. Hi, Daphne.
Hey, Vanessa. Hey, guys.
How are you?
I'm good. How are you?
Good. So for all of you that are tuning in, we had actually met, I think it was about 6 months ago at this point, on a cruise ship, getting CE, having fun. But it was a great time, and a lot of late nights, I think, some of the times, especially with G.O.S.T, late night dancing with G.O.S.T.
He makes it happen.
Exactly. But we had such a great time, and you actually came and visited us here at LocalMed just a couple of weeks ago in Chicago, which was a lot of fun.
Yes, it was a great time. It was really great to see you guys again and brainstorm and just kind of roll ideas past you guys and just reconnect.
Yeah. So why don't you start by telling us a little bit about yourself, what made you want to become a dentist and have your own practice and how all that's going?
So I am one of the odd people in the world who knew what they wanted to do at a very young age. So around third grade, I knew I wanted to be a dentist.
Third grade?
Third grade. So
really?
I just kind of went straight through school with the same idea, and it just, everything fell into place.
So how did you know in third grade?
I don't know. My grandmother used to wear partials, and when I was really young, I used to ask her if I could hold them and look at them in the shiny metal. I just thought it was so beautiful, and I know that's really odd, but I just always loved looking at her dentures and playing with them, and just from there, I just really loved teeth, and I used to draw pictures of braces on magazines, all the stars. I would black out teeth and put braces on them, and it's just something I've always been interested in and always loved it, so I'm fortunate.
That's awesome. And so you're practicing right now in South Carolina. Is your practice actually in Charleston, or is it outside of Charleston?
It's just outside of Charleston in Mount Pleasant. It's just before the bridge that goes into Charleston. So it's a suburb, but part of the metropolis area. But it's great location. We call it Mount Perfect because it's perfect and it's beautiful. And I'm very lucky to be here because I didn't grow up here. I grew up in Pennsylvania. And I met my husband, Tim, who's an orthodontist, when we were in dental school. And he lived here. He grew up here and moved home while I was finishing school. I came to visit. It was really nice. And he said, "You want to move down?" I said, "Yes." And
any way to skip the cold weather, right?
Yeah, I don't mind missing out on that. I don't miss the cold at all. So I've been in Charleston about 17 years.
Yeah. And so I know you were telling your story about what made you interested in dentistry. So why did you not go into orthodontics?
I was interested in orthodontics, and I actually thought I would be an orthodontist before I went into dental school. But once you get there and you start doing the dentistry, you find things that you didn't realize you would like to do. Like, I really loved doing oral surgery, of all things, and taking out teeth and doing surgical procedures and stitches and all that fun stuff, and I liked that, and I considered going into that, but the lifestyle I thought probably wasn't what I was looking for, as far as being on call all the time and seeing a lot of late after-hour emergencies. So I kind of just decided to stick with general dentistry, and then of course I met Tim and figured I'd get my fill of orthodontics by seeing what he does. So And it's funny that, you think you go one way and life brings you another, and it all works out the way it's supposed to, because it's been really a wonderful profession for me, and I really love it. Every day is different, which makes it really exciting.
Yeah. So do you have any words of wisdom or advice for anyone that maybe is in dental school right now, still trying to figure out if they want to just do general dentistry, orthodontics, perio, whatever they're looking at? Do you have any advice for them of knowing what path to go down?
I think the most important thing is to think about your future and think about waking up every day and the job that you choose, to have a job that you wake up and say, yeah, I'm going to work, not like, yeah, I got to go in today. So as far as specialty goes, you have to love it. And if you're considering a specialty, you obviously love it. But just loving your job every day makes it easy, because then you're good to your staff because you're happy, you're good to your patients because you're happy, and you don't feel stressed. And that to me is really important, because dentistry is stressful in itself, so we don't need to add stress by having chosen the wrong path. So I guess just finding what you love, really, that's it.
Yeah. And what's great about you too, with your practice, that I have met your staff and they're all fantastic.
Thank you. I agree.
Daphne is awesome, where she brought her staff on the cruise with as well, which I think just makes such a great team bonding experience and getting to know each other and creating that great work environment. So can you tell me a little bit about your staff and how having a bit more of like a close-knit group has worked for your practice?
So I bought this practice about 3.5 years ago, from another dentist who was retiring, and I had a practice that I brought with me. So when I came to this practice, the staff was all here, and so I inherited everybody that you had met, plus one other girl. Actually, the two hygienists came about a year later, but I inherited staff, and the big concern for the dentist before me was that I was going to let them go, which I didn't, because they knew all the patients and they knew how the business ran, and I just kept them on, and I couldn't have been more happy. I couldn't have picked better people, really. They're kind, they love what they do, and they're honest, and they really care. You can't make people care, and so that makes it easy for me. I'm grateful to them all the time because they make my life easy. I can't do it without them. Yeah. And so, thinking about going on this cruise and should we go? And I was like, yeah, we're going to go because they deserve it. They work really, really hard. They're always sweet. They're always smiling. I mean, everyone has bad days, obviously, but they don't let anybody else see it. Only us, behind the curtain get to see it. But they're wonderful, and they make my life easy. So I want to make sure that they know how much I appreciate them. And being on that cruise was wonderful for bonding. It was fun to be in a different environment where we didn't have to worry about anything but just hanging out and enjoying each other's company, and definitely brought us all a lot closer. And we got back from the cruise and meeting you guys and implementing LocalMed into our practice really just kind of kick-started things, and everybody was excited. And that's we still feel that excitement from just going and doing something different.
Yeah. Well, and speaking of LocalMed as well, I feel like when we first got LocalMed implemented, that was kind of the start of where I feel like we were starting to get into more digital for your practice when it comes to the marketing. So can you talk a little bit about that, of just how you're able to incorporate LocalMed into that, but then also what different avenues were you doing to get new patients?
Well, and this was really important for me because the practice that I bought was an older practice. And I remember talking to you and to Tom about how I'm not sure this is going to work for me and for my practice because my patient base is a little bit older, older than me. And so I'm not sure that they're going to take to the digital platform as well. When I bought this practice, it was not digital, it wasn't paperless, and we did all those things after I bought it. So, right before I decided...
even 3 years ago, sorry to interrupt, even 3 years ago, you guys were not paperless.
No, they were not paperless,
wow.
Not digital. So that was a big deal. So I changed all of that when I came in day one.
You had a lot of work.
I did. And of course, Shannon and Caroline, they were like, okay, but they rolled with it. It was a stressful time for them, but they acted like it wasn't. So they're just the best. But anyway, so I was talking to some patients saying, hey, I'm thinking about getting this online scheduling platform and some reviews. Well, what do you think? And this one older man says to me, well, I don't need to do that because, if I tell you it's a good appointment, it's a good appointment. I said, okay. So I talked to some other people, and they're like, oh, yeah, my wife does that for her haircuts, and I thought, okay, so a lot of people were really familiar with it. So we decided to do it. And the funny part of the story is that man who said, if I tell you the appointment was good, I'm not going to review you. He gave me one of the best reviews I've gotten, which made me laugh so
You're
hard.
Like, yes. Yeah.
Right. But so with that new avenue of online scheduling, we had a website before, and it had just the request an appointment button, and it was marginally effective. I mean, we would get maybe 1 or 2 a month, and then we would try and call them, and sometimes we'd get them to come in, and sometimes we wouldn't. But, having that new platform, we thought we need to put ourselves out there more. So we started doing more digital marketing with Facebook and Instagram, and just kind of making sure we're seen, getting our face out there, and it really helped a lot. So it's amazing.
Now,
I feel
has your staff been helping you with Facebook and Instagram, or are you working with a company that's doing that for you?
Yeah, no, it's basically just Caroline and I and the girls. Caroline's kind of the mastermind. She's, my young millennial. She says hi, by the way.
I love her too. Yes, for anyone who does not know Caroline, she is just so much fun. And her and Ghost are best friends.
That is
best
right.
friends.
They're tight.
Which, by the way, Caroline and Dr. Pierce made Ghost Pierce Family Dentistry t-shirt that says Ghost on the back for Get Online Scheduling Today. I have my Pierce Family Dentistry shirt on as well. And then Dr. Pierce
got
LocalMed.
But so Caroline's wonderful. She's very good at marketing. She's been doing a lot of research and getting involved with some online marketing companies and stuff. So basically she does a lot of it and comes up with most of our ideas. But she's great. She's a perfect part to the puzzle as far as getting the marketing done.
Now, how is that with basically wearing multiple hats then in the office of, your normal 9-to-5 job, but then also getting involved in the social media and the marketing more versus hiring another company? Like, has that been difficult to do at times, or?
Well, most of the time it's not too bad because we're busy, but we're not like crazy busy that we don't have a little bit of downtime. We've set up our schedule in a way that there is some downtime in the morning and in the afternoon. And a lot of the time she does it then, but every once in a while I'll get a text in the middle of the evening and it'll be Caroline, so she's always thinking, so it's been pretty good. But I think if we were to ramp it up anymore, we'd probably have to get somebody else involved to kind of take that load off of her.
But that's exciting that you just have staff that's so passionate about your practice, because I'm sure your practice is your baby, one of your babies. Right. I know you actually have children. I mean, I got my kid here, but you have actual children as well as a practice that I'm sure at times feels like another child. Or maybe even another husband, however you want to look at it.
Right. It can be a lot sometimes, for sure. But it makes you feel good to know that you have people that care as much as you do. And I really feel like they do. And it's nice, makes it easy.
Yeah.
Yeah.
Well, thank you so much for chatting with us today.
Yeah,
if anyone has any questions for you or wants to learn more about your practice, where do they find you?
You can find me at DaphnePierceDMD.com, or you can find me on Facebook, Pierce Family Dentistry. And then obviously I have a personal Facebook page, Daphne Pierce. Reach out anytime. Happy to answer any questions.
Yes.
And I have to leave you with one story before I go.
Oh, go for it, yes.
I just had, it was funny, we had a new patient who was referred into the practice by a next door neighbor, and she works just around the corner, and she says, I can't believe this. And it worked out really well because there was an opening that somebody had canceled. And so she went online the day she was referred, and she went to book on LocalMed, and there was an appointment the next day, and she filled out all this stuff, and she came in, and I said, well, how'd you find us? And she said, your neighbor told me to come to you. And I said, oh, that's great. And she goes, and I just couldn't believe it. She goes, I went online, and it was like so easy and convenient. I got an appointment. I got it right away. I filled in all my information, and here I am. And I'm just so glad to be here. And I was like, me too. So it's really great. I was like, yes.
Oh, I love it. I love it. And that's got to be such a good feeling for you, too, because it's like knowing that before you even saw the patient, they already had this positive experience and we're really excited to be at the office.
Right. And that's what she said. She goes, you're just up on the newest and the latest. And I thought that was great. And I was like, yeah. And the funny thing, too, is I've had a lot of my existing patients use it, and they love it. They're like, this is really neat. And I'm like, good.
Yes. Well, and I think you even had sent to us for a sign in your office, right? You made a sign that lets people know that they can book online.
Right. We want them to use it, especially if we're not here. We want them to be able to get in touch with us and do what they need to do.
Yes. Well, and especially with being coastal where you're at, and I feel like lately being a lot of crazy storms, whether it's hurricanes or residue of hurricanes, and so I'm sure that's probably helped you guys out too. So even if you're not at the office or you have no power, but maybe other people do, where they can still book appointments or need be. So
and that has happened in the last 2 weeks. We've taken multiple days off for the hurricane, and one time we had a Comcast outage, and I thought it was great because we actually booked 3 appointments when we had no phones.
Oh wow.
So it was really great. So
that's perfect.
It's a great adjunct, and it's a great tool, and I'm happy to be a part of it and happy that you're part of my practice.
Oh, well, we love being part of your practice. Obviously, we are representing today.
Love it.
We really appreciate you being here. Thank you for being part of Ghost Stories. And if anyone else has any questions about LocalMed, feel free to reach out to Daphne. You can talk to someone who's actually utilizing it. Or obviously you can go to our website, localmed.com/dentist, or check out our Facebook, which is probably where you might be listening to this. And then we will see you all on the next chapter of Ghost Stories.
Bye.
Bye.